Hello, I'm Dr. Anna Morgan, a urologist and health educator for adults who want clear, actionable guidance. Today, I'm going to explain the number one sign your kidneys are failing and exactly what to do about it so you can respond early, protect your health, and feel in control. For years, I've watched people miss subtle kidney signals because they felt too ordinary to matter, or because life was busy and the body seemed to keep up anyway. Then one day the fatigue is heavier, the blood pressure is stubborn, the rings feel tight, and the shoes leave marks at the end of the day. By the time some patients arrive to clinic, they look back and realize those ordinary signals were the body asking for attention. My goal is to make this crystal clear, practical, and reassuring. You don't need to panic. You need to know what to look for, why it happens, and how to take smart steps right away. The number one sign most people ignore, yet shows up early and reliably when kidneys are struggling, is persistent swelling from fluid retention, especially in the ankles and feet by day and around the eyes in the morning. We call it edema. Here's why it matters. Healthy kidneys are expert filters and fluid managers. They remove wastes and extra water, balance minerals, keep proteins where they belong, and help regulate blood pressure through hormones. When the filtration units in the kidneys, the glomeruli, begin to fail, two things often happen. The body retains sodium and water, and valuable proteins can leak into the urine. Those shifts pull and push fluid into the soft tissues, producing swelling that doesn't behave like normal day-to-day puffiness. This is not the mild ankle mark you get after a long flight that vanishes in an hour. This is swelling that shows up repeatedly, lasts, and slowly becomes your new normal. If you're thinking, but couldn't swollen ankles come from other things? You're absolutely right. Heart issues, certain medications, venous insufficiency, hot weather, long periods of sitting, all can cause swelling. That's why you never diagnose yourself off a single symptom. However, in people at risk, over 50, high blood pressure, diabetes, family history of kidney disease, recurrent kidney stones, history of frequent painkiller use, persistent edema is the body's warning light. It often travels with two other early signals: higher blood pressure than usual and change in urine character, like very foamy urine that doesn't settle quickly, or more frequent nighttime urination. Taken together, these form a pattern you should never ignore. Let's make this practical right now. Sit comfortably and press a finger gently over the bony front of your shin or just above your ankle bone for 5 seconds, then release. If a noticeable pit remains for more than a few seconds, that is pitting edema. If this happens repeatedly over several days, especially if your shoes feel tight, your socks leave deep ridges, or your eyelids look puffy in the morning, you have useful information. It doesn't prove kidney failure, but it does demand action. Early kidney decline is often silent on the inside and visible on the outside through fluid shifts. Your job is to catch the pattern and respond. Here's what to do first, before any appointment. Step 1. Measure, don't guess. Weigh yourself each morning after using the bathroom and before breakfast, wearing the same type of clothing. Log the number. A gain of 2 to 3 pounds in 24 hours or 5 pounds in a week, when you haven't changed your eating dramatically, often signals fluid retention. Pair that with a quick ankle check and a daily blood pressure reading taken after 5 minutes of seated rest. Write all 3 down. By the time you see a clinician, you'll have a mini timeline that speeds up evaluation and protects you from "it must just be your age." Step 2. Make a same-week appointment with your primary clinician or nephrology/urology team. Ask for a kidney panel and urine tests. Serum creatinine with estimated glomerular filtration rate, eGFR, a urine albumin to creatinine ratio, UACR, to check for protein leakage, and a basic urinalysis. If you have diabetes or high blood pressure, these tests become even more urgent. Labs are not to scare you. They're your baseline. We're trying to answer 3 questions quickly. How well are your kidneys filtering? Are you leaking protein? And are there signs of other issues we need to catch now? Step 3. While you're waiting for labs, reduce the 2 biggest short-term drivers of edema you can control at home: excess dietary sodium and long periods without movement. Replace salty snacks and processed foods with simple, fresh options. If a food comes in a crinkly bag and tastes intensely savory, it almost certainly carries a sodium load that pulls water into your tissues. In your cooking, choose herbs, citrus, garlic, pepper, and olive oil to build flavor without salt overload. At the same time, set a timer on your phone to stand and move for 2 minutes every hour you're awake. Calf muscles are auxiliary pumps for venous return. When they contract, they help push fluid up and out of the legs, telling your circulation and kidneys, "Let's move this along." Now, let's zoom out and understand the physiology simply so you remember what's happening. Inside each kidney are about 1 million tiny filters called glomeruli. Blood arrives, is filtered through a delicate membrane, and essential substances are reclaimed while wastes and extra water become urine. When the glomeruli or the surrounding structures are damaged by high blood pressure, diabetes, inflammation, toxins, long-term heavy use of certain painkillers, or repeated obstruction, 2 early consequences appear. First, the filter membrane becomes less selective and may let protein spill into the urine, creating that stable foam that doesn't disappear quickly. Protein in the urine changes fluid balance in the blood and encourages swelling in tissues. Second, the kidney's ability to excrete sodium and water precisely is impaired, so the body holds on to both. Fluid that should be in your blood vessels migrates into the ankles and soft tissues, and your blood pressure creeps up because the system is volume loaded. This combination, protein leakage, sodium-water retention, higher blood pressure, creates a loop that stresses the kidneys further. Breaking that loop early is the entire strategy. Let's build a clear plan you can follow starting tonight. Immediate actions for the next 7 days. Weigh yourself every morning and record the number. Check your blood pressure daily after 5 minutes of seated rest. Feet on the floor, back supported, arm at heart level, scan your ankles and lower shins for pitting, and note any persistent morning puffiness around the eyes. Schedule your labs and keep that appointment. In your meals, aim for fresh rather than packaged, and use a simple plate: half vegetables, a quarter whole grains, or starchy vegetables, a quarter protein in portions that fit the palm of your hand. Drink water regularly through the day, but avoid late-night chugging. If you consume alcohol, keep it modest and not nightly while you're evaluating swelling. And pause non-essential NSAIDs like ibuprofen unless your clinician has told you to continue. These painkillers can reduce blood flow into the kidney filters and worsen fluid retention. Add 2 supportive habits to amplify your results. Gentle walking for 20 to 30 minutes most days helps your blood vessels dilate and your calf pumps move fluid. And a 5-minute leg elevation after dinner can be remarkably effective. Lie on your back with calves resting on a chair seat so your knees are bent, and breathe slowly. This simple position encourages fluid to leave the lower legs and return to circulation, where your kidneys and your nightly trip to the bathroom can handle it. This is not a medical procedure, it's intelligent gravity. When your lab results return, here's how to think about them. eGFR estimates how well your kidneys are filtering. Higher is better. UACR tells you if protein is spilling into your urine. Lower is better. If your eGFR is lower than prior values or your urine shows albumin, your team will identify causes and set a plan. Sometimes addressing blood pressure more assertively, tightening diabetes control with safe targets, stopping a harmful medication, treating an underlying inflammatory process or relieving obstruction can stabilize kidney function. If your labs are normal but your swelling persists, Your clinician will look for other causes, heart, veins, thyroid, medications, and you've still done the right, timely thing by seeking evaluation. Because many of you want clear thresholds, here are red flags that mean urgent care, not a routine appointment. Seek immediate evaluation if swelling rapidly progresses and is accompanied by shortness of breath, chest discomfort, confusion, severe fatigue that is out of proportion, or a sudden drop in urine output over 12 to 24 hours. Those combinations can indicate fluid overload that stresses the heart and lungs, or an acute drop in kidney function that needs prompt treatment. Do not wait and hope on those days. Let a professional decide after examining you and checking labs. Now let's talk about what preserves kidney health day after day, because swelling isn't the whole story. Consistency is. First, aim for steady, realistic blood pressure targets that your clinician recommends. For many adults, that's in the 120s to 130s systolic when measured properly at home. Home monitoring empowers you to see patterns, not guess. Second, if you live with diabetes, agree with your team on a safe A1C target that fits your age, medications, and risk of low blood sugar. Extremes harm kidneys at both ends. Steadiness protects them. Third, choose protein in reasonable portions rather than oversized servings. Your body needs protein for repair and immune function, but excess protein can raise filtration load unnecessarily. Use your open hand as a visual portion guide and discuss specifics with your clinician if you have advanced kidney disease. Fourth, know your pain plan. If you need pain control, ask your clinician which options are safer for your kidneys and under what circumstances. Many people don't realize how often they reach for over-the-counter pills that are unkind to kidney blood flow when used heavily. Fifth, move with kindness. You don't need a gym to help your kidneys. You need regular walking, gentle strength for your legs and back, and breathing that lengthens your exhale. Movement opens vessels, reduces stiffness, and helps blood pressure behave. Sixth, sleep. Chronic short sleep raises stress hormones that push blood pressure up and interfere with glucose control. A calmer nervous system is kidney protection by another name. Seventh, avoid smoking and keep alcohol in check. Both harm blood vessels over time. Finally, keep your vaccines and general health maintenance up to date, because infections can temporarily strain kidneys and the heart, which often worsens fluid retention. Because this is real life, let me give you 3 short stories that illustrate the path. A 62-year-old accountant noticed his socks were carving deeper lines by late afternoon. He blamed summer heat. 2 weeks later, his shoes felt tight daily, and his morning eyelids were puffy. He weighed himself, saw he was 3 pounds heavier than his usual, and booked labs. His blood pressure was higher than his normal 100s 25s. He was in the 100s 40s. Labs showed a mildly reduced eGFR and protein in the urine. He and his clinician tightened blood pressure control with an evidence-based medication that also reduces protein leakage, adjusted his sodium intake, and created a movement routine. 3 months later, his swelling was rare, his blood pressure steady, and his urine protein improved. The turning point wasn't panic. It was recognizing edema as a real signal and acting early. A 71-year-old retired teacher had ankles that swelled every evening. She assumed it was her age. When nighttime breathing felt a little labored, her daughter convinced her to seek urgent care. The team found fluid overload related to both heart function and kidney strain. With treatment, diuretics monitored carefully, and a new plan for blood pressure and salt intake, she felt dramatically better within weeks. Her takeaway to me was simple. I thought swelling was just part of getting older. I didn't know it could be a fixable sign. It often is. A 55-year-old warehouse manager with a history of heavy painkiller use after a back injury developed swelling and very foamy urine. He thought the foam was just stronger urine and ignored it. Months later, he felt exhausted and came in. His labs showed significant kidney impairment. Changing his pain plan, addressing blood pressure, and diet helped stabilize his function. But he told me he wished he'd acted when the foam and swelling began. If you notice urine that looks persistently frothy or foamy and it's not from forceful urination, it's worth checking a urine test. That small action can save a lot of future trouble. Let's also clarify common questions so you feel fully equipped. Is swelling always obvious? Not always. Some people first notice tight rings, facial puffiness, or a sudden need to loosen their belt. That's why daily weighing and paying attention to how clothes fit matter. Can edema be one-sided? Occasionally, but kidney-related edema is usually symmetric in both legs. One-sided swelling often points to a local vein or lymph issue and needs evaluation too. Should you drink more water to flush your kidneys if you have swelling? Not blindly. Hydration is important, but overdrinking late in the day may worsen nighttime trips and fluid shifts. Focus on steady daytime hydration and follow your clinician's guidance if fluid restriction becomes necessary in certain conditions. Should you cut protein sharply? Not without guidance. Severe restriction can cause muscle loss. Moderation tailored to your kidney function is the goal, not extremes. What about supplements labeled kidney detox? Be cautious. Many are not evidence-based, may contain hidden ingredients, and can interact with medications. Your kidneys do not need detox teas. They need you to lower blood pressure, manage glucose, reduce sodium, avoid unnecessary nephrotoxic drugs, move regularly, and catch early signals. That is the quiet, proven path that works. Now, if you're wondering how to put all of this into a week without overwhelm, here's a simple template. Morning. Weigh yourself, log it, take your blood pressure after sitting quietly, and note ankle swelling. Drink a glass of water. Have breakfast that's low in sodium, oats with berries, scrambled eggs with tomatoes, or yogurt with sliced fruit and a handful of nuts. Midday. Choose a lunch with fresh vegetables and a sensible portion of protein. Take a brisk 10-minute walk after eating, if possible. Afternoon. Set your hourly 2-minute movement reminder. If you sit long hours, do 10 calf raises while you heat your tea. Evening. Eat earlier rather than late. Keep dinner lighter than lunch. Elevate legs for 5 minutes after. Avoid salty packaged snacks. And maintain a consistent bedtime. Do this for 7 days and watch your logs. If swelling settles and your weight drops a bit, you've likely reduced fluid retention. If swelling persists or worsens, your logs strengthen your case for deeper evaluation. 2 mindset shifts will help you stay steady. First, trade fear for curiosity. Fear paralyzes, curiosity mobilizes. When you see swelling, ask, "What is my body trying to tell me today?" Then respond with the simple steps you've learned. Second, respect your timeline. Kidney issues develop over years. They improve over weeks to months. The actions you take now, measuring, reducing sodium, moving, adjusting medications with your clinician, work quietly. You may not feel fireworks, but you will feel steadier. That steadiness is the success. I want you to have one concise test to remember. If swelling is recurring and paired with foamy urine or rising blood pressure, combine home tracking with prompt lab evaluation. Do not dismiss it. Do not wait for a dramatic symptom. The kidneys whisper before they shout. Your job is to listen to the whisper. Let me summarize the essentials you can carry from this conversation into action tonight. The number one sign most people overlook when kidneys are failing is persistent swelling. Ankles and feet by day, puffy eyes in the morning, caused by fluid retention and often protein loss in urine. The first actions are simple and powerful. Measure daily weight and blood pressure, check for pitting at the ankles, reduce sodium, move often, elevate legs briefly, and schedule labs for eGFR and urine albumin. Pair these steps with a calm, consistent routine that supports blood vessels and pressure. Seek urgent care if swelling accelerates and comes with shortness of breath, chest discomfort, confusion, or very low urine output. And remember that protecting kidney health is not a single decision. It's a set of quiet, repeatable choices that help your filters do their job for years to come. If this conversation gave you clarity, choose one action to begin tonight. Maybe it's setting out the bathroom scale and a notebook. Maybe it's preparing a lower sodium dinner. Maybe it's placing a gentle movement reminder on your phone. If someone you care about has swollen ankles they keep ignoring, share this guidance so they don't wait for a louder alarm. And if you want more straightforward education like this, stay with me. I'm here to help you notice early, act wisely, and protect the quiet engines that keep you well.